Welcome back to my YouTube channel. This is Dr.J. I'm currently training to become a family doctor. I believe knowledge is power and sharing is caring. And that's why I'm here for you guys. If this is your first time checking out my video, make sure to subscribe my channel by clicking the button below. And also, don't forget to turn on notification so that you don't miss out on my upcoming videos. And I would love to stay connected with you guys. You can find me on my Instagram, and you can also feel free to leave comments below. And now, it's time to get started! You would have seen COVID-19 every day from news and social media. You could have also come across clips of healthcare workers making sacrifices to protect the community. If you're wondering, what is it like to be a frontline healthcare worker during COVID-19? And what's actually happening in the hospital? Well, you came to the right place. Today, we will be uncovering what's happening in the emergency department with Dr. KevinDong. He's an emergency physician working in Hamilton hospitals. He will be sharing his work experience during COVID-19, some of the unique challenges he and his colleagues faced, and a recent trend that he has noticed about people's reluctance to seek medical care. So make sure to watch it till the end. And stay tuned! Let's welcome Dr. KevinDong. Can you please introduce yourself?
Thank you for having me, Jay. My name is Dr. KevinDong, or you can call me Kevin. I'm an emergency medicine physician working in Hamilton and being heavily involved in the fight for the COVID-19 pandemic. So thanks for having me.
For people to have a better idea, are you able to elaborate on what settings you're currently working at?
So I'm an emergency medicine physician. Essentially, my place that I work in is either both the Hamilton General Hospital as well as the Juravinski Hospital, which are two different sites. And we do see different populations of COVID patients as well, especially in the last few weeks or so. So I'm happy to be here and share my experiences with you and for the public.
There's a significant attention from the public about working as a frontline healthcare worker in the hospital. And I was wondering, what has your experience been working in the hospital?
So it's been an experience of a lifetime in terms of all the things that have been going on in the last couple of weeks regarding this virus. I think the first thing was kind of the uncertainty of what everything has been going on. And as we know, there's not a lot of good regulated protocols or standardized papers that have a lot of tips and tricks and pearls about how to tackle this virus. So I think this has been difficult in that aspect. And so going day by day and trying to treat all these patients that are coming in, I think has been the biggest challenge. However, I'd like to really say that our group as a whole, across Canada, we've been really working hard to make sure we work together to tackle and fight this virus together. And I think we've done a phenomenal job of learning such fast speeds and really adapting on the fly to make sure that our patients across the board have been taken care of the best as we can.
It seems like we're taking things day by day. The other thing I wanted to touch on is personally, I believe being a doctor and providing care during this time make it especially rewarding yet challenging at the same time. For instance, I know some of my colleagues who are making significant sacrifices to provide care, and this includes working in a hospital without sufficient resources or even staying away from their family members just so that they don't expose them to the COVID-19. What has your biggest challenge been working during this time?
I think anxiety definitely becomes the first aspect that, like you just mentioned, Jay. Some of my colleagues are actually staying away from their loved ones, whether they're children or whatnot, because they're so scared that we're high risk for asymptomatic carriage. So to give this to our loved ones would be devastating for all of us. I think that's been a difficult challenge. I think we were talking beforehand about like essentially this has changed our entire world. I mean, when I go home, I essentially have to strip down to the nines and making sure that none of the stuff goes in home and then really jump in the shower and really, decontaminate. And I think, going into work, you think about getting it, I think really makes you frightened, right? You have a fear for it and definitely respect for the virus. So I think that all those things are definitely making the whole process very difficult. But at the same time, I think when you put that hat on as a doc and you're really there to make sure that your patients in the communities is being taken care for, I think that really gives you that courage to go and really work on the front lines and take care of these patients. So definitely it's been a challenge personally. And I think my colleagues and I have definitely shared these challenges and struggles, but at the same time, I think we're working together to really support each other mentally as well as physically to be the best that we can be for our patients. So, day by day.
I truly respect all the work that you guys are doing as a frontline workers, and I can't personally imagine what you guys are all going through. So kudos to you. The other thing I wanted to touch on is there's an increasing concern from the public about reluctant to seek medical care. And for instance, in my clinic, I definitely noticed a drastic decrease in number of patients who are calling in and coming into my clinic. Have you noticed similar trend in your hospital as well?
Unfortunately, I think there's been some miscommunication about, whether you need to go to the hospital for medical care. Now, I think as a community and as a country, we've done a great job of actually getting the message out there that we need to stay home and stay safe. But at the same time, I think there's a legitimate fear about going into the hospitals because people don't want to catch the virus, which is true. But at the same time, if you think about the thousands of other things that you can actually get ill from, like heart attacks and strokes, those things won't wait for you. They need to be taken care of, and you need to make sure that you go to the hospital. So I think there has been some, whether delay in care, unfortunately, because the patients are afraid to go to the hospitals, or they don't go at all, and so something gets missed. And I think that's unfortunate because we really want to make sure that we take care of our patients from all angles. For example, I had a patient who was in their 50s, very healthy, and actually had a stroke, but decided to come in way too late, and actually, came 4 days after, where we weren't able to intervene. So that was very tough, and I think it makes it really tough for all the caregivers, because all we want to do is really make sure that we catch these early, and so that we can intervene, and so that these patients can have a great quality of life.
That's very unfortunate in terms of what happened to your patients in the hospital. I think there's definitely extreme fear and anxiety of going into the clinic or going into the hospitals. So I would like to ask this question on behalf of other people. Is there any protocols or different measures that are in place in the hospital to keep patients safe from COVID-19?
So the protocolization of this pandemic has been definitely a process for sure. The one thing I've seen through this virus and the whole, the destructive path that it's had is that it's really brought all the leadership in the hospitals together to try to create these standardized protocols so that we can provide the best care for our patients. For example, we essentially converting a lot of rooms to make sure that they're negative pressure rooms, so that when patients come in and they're in extremis, that we have a good protocol, not only to make sure that our patients are safe, but also that our healthcare workers are safe from the virus as well. Protocolization in terms of practicing and using our simulation labs to make sure that we are well prepared to do these high critical care procedures like intubations for our patients and putting people on ventilators. And so these protocolizations and practices have really helped our frontline workers to prepare and become the best that we can be in terms of very uncertain settings to care of our patients. Other things is that there's been a lot of collaboration between all the leaders, especially all the different departments that we've never seen before. So to go back to your main question, yes, we have definitely protocols. We're working on it day by day. We're constantly updating it to make sure that we're up to date in terms of our care. And I think that camaraderie and that teamwork we have is really helping our frontline workers prepare and give the best care for our patients.
You've shared so many excellent advices, but do you have any last key message that you would like to share with the public?
For sure. I think we've already talked a little bit about some of the things that are really important. I think as a community, we're doing an excellent job of physically distancing and staying home and making sure that we take care of all the vulnerable populations. At the end of the day, yes, we're frontline workers. We're in the fray. We're helping out, and we're really getting exposed to the virus up and center, up and close. But I think this is a team effort from everybody, and that includes the community. So people need to make sure that we're doing this because we're protecting our most vulnerable. So the elderly, the people that have multiple medical conditions, our children. And so, everyone doing a little bit of sacrifice to stay home, staying safe, respecting others, making sure that they advocate for their fellow communities. I think those are the main things that we need to do. I think the other aspect is, and we talked about this, is that if you're sick, come to the hospital. We're doing our best to make sure that our hospitals are safe and that we're preparing so that we can take care of you the best. If you're having chest pain or other symptoms, those can be indicative of other bad diagnosis, not COVID. And so we want to take care of you before you get, essentially too sick to be treated. And lastly, I think, one of the things that we are doing well is supporting each other from a mental aspect. I think there is a lot of anxiety and difficulties from this virus that is invisible, right? Things that we don't see. And I think you touched on this a lot in your first video, vlog there. But I think that we need to make sure that we check up on ourselves and check up on our colleagues and our friends and our families to say, how are you doing? And using social media and actually video virtual channels to good use in that aspect, right? And saying, checking on these people, making sure that they're well. And so making sure that you're well, because we need to make sure that we're strong so that we can fight this virus together. So those are kind of the three key messages I think I have as a frontline worker and as a medical practitioner. And I think that together we can fight this virus one day at a time.
Thank you so much, Dr. Dong, for sharing your experience and excellent advices. I hope the public found it to be helpful as well. And at the same time, I would like to thank you and your colleagues for working hard to keep everyone safe and healthy in the community.
Thanks for having me. Stay safe, everyone, and let's hope that we can get through this all together very soon.
I hope you guys enjoyed the video. And if you did, make sure to subscribe to my channel by clicking on the button below. And also make sure to turn on your notifications so that you don't miss out on my upcoming videos. I would love to hear your experience of going through COVID, so make sure to leave a comment below. You can find me on my Instagram, and remember that being wealthy is healthy. I will see you guys next time.